I am an educator to dentists besides just being a dentist to you, hopefully.
Yeah.
And I do a lot of reels and social media teaching dentist stuff. I even have a podcast where dentists listen to me on really what you and I are doing. Like, how do you meet a new patient? How do you know what to recommend? And so there's a guy, don't look, in the hallway filming me. He can't see you, he sees the back of your head. Okay? He sees me, but he can't, and he hears me, but he can't see you.
Okay.
Is that okay if you don't want him to? Like, well, he won't come in here.
Oh, you're not joking.
No, he's out there.
No, it's all right. I
Yeah,
guess.
I mean, sometimes I use them,
You're
sometimes
saying
I
this
don't.
because of the fact of the teaching.
Yeah, I am. That's why I'm saying this to you. And I'm so good at it that I forget that I'm even being filmed.
Did you?
And then we use about 10% of what we do.
Okay.
But sometimes it helps them because you know what? Dentists struggle with this. And if you think about it, I know why they struggle. What did you do for a profession? I have a reason to ask you that. What did you do?
I'm a musician first and foremost. French horn player.
Okay. How about you? I'm curious.
Wallpaper hanger.
Okay. So this is my instant reaction when you say a musician, or even what you do. Because they're very specific things.
Mm-hmm.
You really can't be half in and be a musician, right?
No.
Why would you be a musician if you're going to be half into it? It's got to be passion and a love to practice and do all that stuff. And, you know,
Yeah.
you're hanging wallpaper, that's not like you work at the motor vehicle department.
Yeah.
And to be honest with you, it's not even like being a teacher in a school system because that can get old and burned out. And I tell you all that because it is extremely common, in my opinion, in my own profession, that I've been one for 45 years. It's extremely common for dentists to get burned out. 'Cause it's hard. It is. And if you get burned out as a dentist, it's very unlikely that you're going to just say, hey, I'll try real estate or something. Because you got so much into it. And the problem is, if you're half in, you don't do what you need to do to be valuable to you. Because like you come in here today, it's a perfect example. And you're thinking maybe of some type of posterior replacement. And what am I going to say about all that, you know? Well,
Yes.
you got to have an approach, you know. Back up a little bit. You got to have an approach. And the approach I have, I'm totally confident with. I've done it for years. I go over what you have because I don't know what you have. I mean, you have a lot of teeth. I can see that. But what condition are they in? I need to know. I don't need to make you perfect. I just need to make sure what you have to start with is healthy. Right? I mean, what good would it do you, for you, if I love doing implants? I have an institute. That dentists come here and I teach them how to do implants. Of course I love them.
Mm-hmm.
But what good does it do to go after that if there's a problem brewing that
Yeah.
you don't even know about? And in dentistry, that's very common. Like, a lot of what we treat is asymptomatic. Like, if you hear me play the French horn and I'm bad, you can't get away with that. You instantly know it,
Yeah.
right? You hang wallpaper terribly, somebody's going to notice.
Yeah, right.
Right?
She's had those customers. No,
But
not that she was
but
bad.
you know what, in
but-
dentistry, you can have cavities, you can need a root canal, you can have all kinds of stuff, and it doesn't have to physically hurt. So it's my responsibility I'm hoping, by the way, you need nothing. I mean, I'm cheering for you, because I've been doing this for 4 decades. We do sedate patients like you described, and patients love that.
Mhm.
They do, and I don't blame them. I mean, I like them being sedated, because I do my best work when a patient's
Calm.
just relaxed.
Yeah, calm.
You know, and I've done it for 26 years, and I have never had one untoward incident, not one. I've never had to call 911. I never got alarmed because maybe they were too sedated. It's the perfect combo if you have apprehensive anxiety.
Mm-hmm.
So let's start off by, I spent my whole life doing it. It's all the time, and I've never golfed. Not that that's a bad thing, but I've never, you can't do everything, right? There's only 24 hours. You got to decide what you want to do.
Yeah. Yeah.
I never golfed. I don't have a boat. You know, I'm pretty
Yeah,
boring.
it's like I still practice every day.
You do?
Yeah.
Right.
I warm up and I practice every day because it's me.
Yeah, exactly.
It's me, and as long as I can do it, I will.
Right. It's
Yeah.
exactly where I'm at. I mean, I don't
So-
have to do this
and
anymore.
I'm
I could be.
All my people my age or
Right.
younger have given it up. You know, they're too old. They're not playing like they used to. They have one reason or another. Not me.
Yeah.
I did it because I love it and wanted to do it, and I'm not gonna stop it.
Well, we're the same people. You're a musician. My instrument is dentistry.
Yeah.
Right, it's the truth. So I like to start, and I don't know what you have, but we're gonna go look through it together. And I know that you're not a dentist, you don't have to be.
And I don't look like pictures, but that's
Well, these are
okay.
X-rays.
I know.
It's kind of. If you don't have to look at them, I can just look at them for you.
Okay.
Okay. So
Well,
I'm looking at your
It's
upper
all
right
right.
for starters. Okay.
okay.
And I do see something on your second one in. So you see all these white things?
Yeah.
They're old fillings that you've had done.
Wow.
They are. And if somebody said, you got one shot to look at her, this is it, I'm not going to show you the rest, what would you think? They said that to me?
Yeah.
I like your bone. I know this sounds weird, but when I see good bone, I get happy because it's the number one reason people lose their teeth is called periodontal or gum disease. Now you can have gum disease and not lose bone. I don't know what your gums look like. But if you have bone loss, you definitely have gum disease.
Okay.
And I don't see bone loss. There's certainly not a lot. I do see a lot of giant fillings,
I know.
like quarter pounders.
I know. My
So-
mouth is nothing but fillings. Just I'm lucky I have anything there at all.
So let's start with that concept. I don't change fillings just because they're old or even ugly to me. Okay? This is like I teach other guys to be as conservative as you can be as long as you're not being neglectful. Understand? So some people aren't like that. Some people see silver. Oh, I gotta get rid of the silver fillings. I haven't even looked at your mouth yet. Or it's not a perfect filling. You know, I've been doing this a long time. Very few people I've met have a tree in their backyard with money on it. All right, money doesn't grow on trees,
Right,
but
right.
and everything's expensive today. Is it not? I mean, I ordered salad from DoorDash a couple weeks ago for dinner with I had a little chicken on it or something.
Uh-huh.
It's like $75.
Oh.
Everything's expensive. So
Where
my
was
first
that?
view is
Yeah.
you do have decay on your second tooth.
Oh.
You can see it right there, a dark spot right there.
Yeah.
And it's a little bit worrisome to me because you got a nerve right next to it.
Okay.
And that's how you end up with what's called a root canal.
Oh dear.
I'm not saying you need one, I'm just saying this is what's in my brain. So so just if you're wondering, I'm over here on you right now.
Okay.
And
Yeah.
I'm going this way.
Yes. Okay.
Go to the
Right
next.
to left.
Right. And this is your front, you've had a crown, you've had some fillings done.
Yes.
We're switching over to your left. It looks like she might have some caries on her left eye tooth. Yeah. I mean, your fillings look, I don't know what they're going to look like to my eyes, and they're not going to lie to me, I can tell you that. They're going to be what they are.
Mm-hmm.
And again, I'm going to repeat. Not only do I try to be conservative, I teach that to, because you don't know me. So if I can be conservative, why not? But being conservative is different than being neglectful. Like just saying, you know,
Yeah.
I'm not going to do this because she doesn't know me is not a good philosophy either.
No.
Drop down to the left. Now we're on your lower left, and this is
Lower left.
one area that you down here
Yes.
that you talked about. I guess you had a partial denture, I was told.
I had two partials. They were separate. I had them made separate, and Penn lost them.
Penn? Like,
Penn Dental School lost them the first visit.
really?
They kept them by accident, and then they got lost. And that's it. And by the next day, Janet was with me, and she knows I had them. And then I took them there for them to look at. By that, I think it was on the way home even. Didn't I say, they didn't give me the partials back?
Yeah.
Well, anyway, so I called right away. And by the time they got back to me the next morning, they said they think the cleaning ladies picked them up and threw them out.
When was this?
Cleaning ladies?
When was this? Like a year ago? 5 years
This
ago?
was about 6 months ago.
Oh, didn't offer to do anything? Yikes.
And then I went back for four. I have their plan for them that they printed out for me.
Okay.
I did go to about another 4 visits maybe. I tried to stick with them,
Yeah.
even though they did that.
Yeah.
But it was just taking too much time.
Yeah.
Because, the resident I had, he was the top, not resident, but, teaching the
Right,
others and all
got it.
that stuff, and he was the top guy. He was always getting interrupted by students saying, could you just come
Sign
and
this
look
off,
at,
yeah,
or
sure.
come look at this, is this okay? So you're laying there, you're there for a few hours, you know, and, or whatever, you know, it just, and the parking and the whole thing going in and out. So, but I hung in there for about 5 visits until I said, this is all taking too much time. And then the plan that he gave me in terms of money too was to me not such a savings of money. So the whole thing didn't seem
So tell me, remember I said like a lot of stuff in dentistry is asymptomatic, doesn't hurt. So tell me in your head or your brain, in terms of your mouth, what were you thinking? Like what, I'm gonna go see this dentist and I hope to blah blah, like hoped,
Okay.
is there any pain anywhere? Was it just your missing teeth?
I was looking into getting implants because I had the partials and I had some reaction, I thought, to the partials. Dr. Bensi thought it was an allergic reaction. He took pictures the next day after I got all these ulcers in my mouth from the partials the first day he put them in. Then he had me go back to Dr. Koifman. That took months and all too, my asthma allergy doctor, to do tests for titanium and all, thinking I was allergic to
Sure.
something of the partials. The plastic I don't know about, but I was tested about 20 different things on my forearm, inner forearm, and there was no serious reaction to any of it.
And did you have the partials made years and years ago?
No, it was maybe 2 years ago.
Was that the first partial you ever had?
Yes.
Is that, you had teeth removed
I
prior to
had,
that?
I had bridge work.
Okay.
I had a bridge work thing that fell apart, or I lost the tooth. So then I lost these, and then it's been so complicated and long ongoing that then I, with Dr. Benzi, because of the cost of implants and you know that it being rather,
Yeah.
I said let me try partials, but I want 2 separate ones. I don't want something going
I
under
got
my
it.
tongue because of the horn playing.
Sure.
Because of my, you know, I'm very sensitive with my mouth. More so than maybe some people, my embouchure, you know, my teeth. I mean, I really, I play the horn. I was a professional. I don't just do it for a hobby
Sure,
or some,
sure.
you know, just for fun. So I'm very sensitive as to what's going on with my teeth and my mouth. And
Now here's where I'm at with you.
Okay.
As I'm gonna look in your mouth, I know I'm gonna be looking at a lot of big fillings. It doesn't matter to me if they're big, as long as they're not on the verge of giving you issues that you don't know about.
Yeah, I
And that's important to me, because you've had in your whole mouth 2 crowns, one on the lower right, all the way back, and you had a root canal on that too. And a crown on this tooth, which doesn't look very good, by the way.
no, it doesn't. That's this one right here that Dr. Lou and Dr. Benzi's out with back problems for months. Dr. Lou just built up the post because this kept falling out, the crown. It kept coming out on its own because it's getting too much, you know, with the teeth missing behind it, I think it's
She's
getting,
pointing to the right side. Or left side, I mean.
Oh, I'm sorry.
yeah. I'm talking about this crown here
Okay.
that he built up.
Okay,
Are you
I see
talking
it.
about
No,
another
I
one?
see the
Oh,
crown
okay.
you're talking about. Yes, I
Okay.
am.
Oh, you are?
I'm talking about the next tooth to the second one from the back on the right.
Second one.
From the back on the
Right.
right, yeah.
Oh,
Yeah. It's not.
oh, okay.
Yeah. There's an old saying that I use. It fits like socks on a rooster. Picture that in your head. Okay? It's, so you can see it. I mean, that crowns are supposed to cover hermetically wherever you drill. And I'm not trying to be picky and be a dental school instructor. I'm just being real here. Like the one behind it, very good. That one, not so
Not
much,
good.
not at all. So it worries me because I want to be honest with you. So let me look in your mouth. I'm really good at giving you an honest appraisal of what I would do if I was you.
Okay.
And so I'm going to do that. I can
Well,
tell
that's
you,
why I'm here, because I've been to about 4 or 5 dentists.
I'm pretty
and
reluctant.
dental, you know, that don't say these things to me. They're
Well-
not looking at the whole picture.
I can tell you right off the bat, I'm pretty reluctant. If you don't mind me asking how old you are.
78.
So I'm pretty reluctant to give somebody in their 70s a partial for the first time, unless, like, it's front teeth and I don't have any choice. You know what I mean? Like, I would almost say to a patient, I know this is out of the box, but I would almost say to a patient, I don't know, you might want to just live this way. without it. Because so many patients end up like you. You're not unique with the partial story.
Oh, well, yeah, I mean, I'm not really looking that much to do partials unless
Yeah.
you,
No, I
you
get
were
it.
someone
Yeah.
who was really, this Dr. Bullock that I saw in Marlton the last time, and Dr. Land sent me to see him for a consult. He said he didn't think I was a good candidate for partials or bridge work or anything, so.
Who's Lamb? Is he
He's-
Periodontist
yeah.
that was gonna place implants. Bullock is
Yes.
who's gonna restore them.
Yes.
Some
Oh,
operations
okay,
was
okay.
uncomfortable doing
Say again?
implants. Some operations was uncomfortable doing implants because of her reaction to the
Or,
partials.
or the crowns, they wouldn't even, they just said no to me. I mean, I've been there 15, 20 years. And they, after the partial the situation with the partials, Dr. Benzie, before he's been out for a while now, but last year he said, no, I won't do it.
You know what's crazy? I started way before all those guys. And I'm still standing. And I've had 4 back surgeries. Yeah. Last one was
He
2022.
doesn't, oh my God,
Yeah.
have you?
I played
Oh God, don't scream.
I played pickleball on Monday. So when I'm looking at her, go back to my upper right.
You're
Yeah.
concerned about number 2.
2. Well, 2, I don't have a choice. I gotta do something.
Mhm.
I mean, I gotta do 2 and 3.
Okay.
So show me 6. Is all that noise coming from my kitchen? If it is, would you shut the door?
Sure.
I've been spending my weekends babysitting a 3.5-year-old and a 1.5-year-old. I got all the noise I need. I don't need it for my routine.
You're not used to it anymore, so you don't, I know, I'm like very sensitive about noises at
Yeah.
all, aren't I, Janet?
Yes.
Yeah.
Me too. My wife says that she looked up at Google the condition. She thinks I have it. She did.
What is it? What is it?
You look it up,
It's a
like
condition.
sensitive to noises.
Yeah, right.
She thinks I have a condition.
Okay.
Okay, let me see this side. Turn this way a little bit. Okay. Let me see. That's her upper left.
Upper left, you want?
No, oh yeah. Stay there. Okay. So everything gets watch marks,
Okay.
like the whole quadrant. But she does have decay when 22 is a DLB.
Mm-hmm.
Can I say something?
Yeah, please do.
Doctor, I was just at Dr. Lou's about 3 weeks ago, or Dr. Benzie's and Dr. Lou, because Dr. Bullock said I had 3 cavities here. Now, according to Dr. Lou, he said, you don't have any cavities, you're just saying I had 1. But he did say there was a composite that had discolored and he went in there, no decay under it, he said, but he did it. So I don't know where, I don't know who to believe anymore too, because Dr. Bullock says one thing, Dr. Lou says another, now you're saying. And I'm not saying I don't believe you, but it's
Yeah.
just that I just was 3 weeks ago.
I'll give you my opinion on that in a minute. I mean, it's 100%. It's not like it's, I'm 50% sure, I'm 100% sure.
When you're looking at the x-rays earlier, you had mentioned number 11.
Yeah, I did.
This is 11. This is also 11.
So it's the distal I'm worried about.
Mm-hmm.
So that actually could be the buccal filling she has.
Okay.
That's coming up like that. I'm gonna explain. everything to you in a minute, okay?
Mhm.
What I'm seeing anyway. Okay. And I told you about 31 on her.
You
for-
did not, or you said poor margins, but you haven't treatment planned it yet.
I mean, I'm okay watching it, but this is what I have to say to you. When I'm being conservative with you, and I'm really trying, like I can't be, like on the upper right, you need 2 crowns. That's minimal, and then you need a filling or here. I don't know, like if it was me and you were my patient and then Dr. Lou or whoever he said, I said you have no cavities, and he said, I mean, it's not even close. I mean, you have a lot of teeth that either could become problematic. Now, when I say that, you're not going to lose them, you know, but you could lose a big chunk of them.
I already have. I've lost 2 big chunks.
So you both can understand that you can sometimes patch a tire and sometimes you can't. And what you do when you can't patch it is you get a new tire, and the new tire is the crown. And I take no joy in telling you, like, you look like you take care of yourself, you have nice, beautiful hair, and
Oh, stop.
your mouth
But my mouth's a mess.
has been undertreated. It has been treated.
Well, I first of all, I know I have a lot of this. I know you're. Well, I'm just gonna say it. That when I was younger, you know, my mother would take me to the dentist. I know I had them grinding away. That a lot of my fillings are really old, and not the ones I have now. But my teeth were kind of ruined, you know, when I was younger, from drilling and bad dentists. And I've tried, and I haven't had such great dentists. You know, I have had to. Well,
Like, here's what you have.
You're telling me what I kind of already know.
You have
And
a
I have
dentist.
soft teeth and bad, you know, it's
Yeah.
kind of. My mother and father both had bad teeth.
Listen, I'm the son of a dentist, and I have 10 crowns in my mouth. I do.
Okay.
10. So it's not a function that you didn't brush right. Here's
right.
what it's a function of. You probably got your first fillings in 8 or 9 years old. And maybe you get them refilled when you're 18, 19, 20. Maybe again in your late 30s.
Yeah.
By that time, it's almost all filling. Those teeth
Yeah.
usually end up being crowns. I mean, I can justify in a state board hearing, the Board of Dentistry of New Jersey, that protects you guys. That's what they exist for.
Yeah.
I could justify crowning 10 teeth on you blind. I'm not telling you that I'm doing that. I'm just saying I could do that. Let's talk for a minute about your. So there's 2 teeth that need to be crowned, and there's 1 filling, and there's a whole bunch that. Are you religious? You should be. That you should pray that they make it. I don't mean you're going to lose them, but you could have fillings that would never surprise me on you. And the problem is, you know, look, everybody's different. I had a 90-year-old guy come to me 6 years ago, and wanted implants on all his upper jaw. Got rid of his denture. 90. The guy was 90. It's
Yeah.
the oldest one I've
A
ever
friend of
done.
mine is 90. He's doing it.
Yeah. So
He's-
you can't judge
yeah.
people about what they should do by their age.
Yeah.
And it's a little intimidating when somebody like you walks in. You've not had current dentistry, because when you patch fillings all over the place, that's not current dentistry. And I'd be shocked if you had gone to Penn that they didn't plant a lot of crowns on a lot of the teeth I'm looking at, because the result of a big filling is leaks, and the result of a leak is like you have on the upper right. Like, I'm not even positive that tooth's not into your nerve. It doesn't matter to me if it doesn't hurt. And I don't want it to be in your nerve. I'm on your side. I don't need another crown the rest of my life. So I feel like my job is to do diligence as if you were my sister, which you could be at your age. Like what my brother's coming in. My brother's coming in for work. I've been a dentist for 45 years. He's 80. Coming in from California. Oh, thank
Yeah,
you.
okay.
I need more work now. Right? Especially discounted. So let me talk to you about your lower implants, because I teach implants. I know them inside out.
Okay.
The only way we're going to know is from that x-ray you took in the hallway, and I have to spend time with that, which I'm going to do. I know that you have height. So see what she's showing me? Height means from here down.
Yes.
That's important. You do
Yes.
have that.
Oh.
I'm concerned about width,
Yeah.
because when you lose a tooth, your ridge resorbs. It goes this way. Okay? And
Yes.
you've got more resorption on the right than the left for sure. Makes me think the right side was taken out maybe before the left
I
side.
think so.
Like it looks to me
Yes.
like you could have implants on the left, but I'm not. You on the right side you may be able to, or I might have to do what's called a graft to give me some width when if you're going to go that direction. Okay.
Yeah.
I will say one more thing that I am current on things, and most of the time when I would look at a situation like this with this 2 teeth missing here, you have is it 2 or 3? It's like 3.
Well, it was 2, but that's another thing
Okay.
that Dr. Lamb and there, you know, he sent me to Dr. Bullock because he wasn't sure whether it was 2 or 3 on this side.
Well, I'll
Same
know.
thing.
Because here's what I do. I take that x-ray. I'll need a scan of her too. I take your scan and I do a planned session with a company and I measure out every millimeter in your bone. And I will know whether you should have 2 or 3. I will know whether I have to graft first or not. So here's how we're going to approach you. Whether you have implants done on the lower or partial, you need 2 crowns and a filling.
Yeah, I get it.
And I'm being as conservative as humanly possible. I mean it. When I get the read, which I'll probably do Friday morning, because I'm off,
Okay.
and I see you next time, I'll sit here and say, okay, here's the result. You can have this or this, and we'll make a decision together, okay? In terms of if you can't have implants, I don't want to spend a lot of time crossing that right now because I don't know what I think.
I see, yeah.
I don't know what I think. I don't know if I want to put
That's good.
Darl, did I say it right?
Yes.
I don't know if I want to put her through another episode of partial dentures that she may not wear.
Yeah.
I don't know how I feel about that. And look, I'm going to get killed on camera if they hear me say this, but I'm used to saying it. You'd be better off having teeth there. But if God has you intended to live, this is the part I'm going to get killed on, to 104, you're still going to live to 104, with or without me doing something. You may have more tooth problems, but not significantly. Our problems, if I'm your dentist the rest of your life, it's going to be, are these teeth hanging on, or am I doing 2 crowns a year on you for the
Yeah.
next 5 years? I'm serious.
Yeah.
Because I could justify a lot more than 2. Like the first one
I hear you.
is that guy down there. I'm just trying to be nice to you. Because I hate that crown, but
I don't even know which
I
one.
know,
I get this.
and
I don't even know
and
what's
I'm
what.
not doing it. Yeah.
Yeah.
Okay.
Yeah.
And there'd be people that would say you're wrong for taking that approach because you can see it doesn't fit, and it doesn't.
Is it the one just this the first one after the missing?
After the back one. Yes.
No,
yes.
If the first one here.
Yes,
or
that's the
what
first
I
one.
thought. I thought. Yeah, I didn't like the.
It
look.
doesn't fit you. You can see
It
it.
looks like it has a cavity in it, in the front, where you can because of the other teeth missing. It looks to me. I've looked at it. I don't look at my teeth often because
I feel
it grosses me out
I think-
too much.
I think I have to tell her to do that.
What?
That's like malpractice not to do that. The one I just told you I wasn't going to do.
Oh,
It looks so awful.
yeah.
Yeah. I mean, I've had crowns.
So that's 3 crowns now.
That's 3.
Yeah.
And one is because it's a crown already.
Yeah.
Okay, here's what we're gonna do. I didn't know what you needed when I walked in here. I'm pretty comfortable. When was, by the way, I didn't even ask you this. You look fairly clean. When was the last time you were cleaned?
That I was.
You had a cleaning.
Oh, April or May.
Okay.
Yeah. But see, I've been going to Dr. Benson's Smile Creations. I've been going there and seeing Dr. Benson a good 15 plus years. And it's only recently that 6 months he hasn't been there in the back. And I've only seen, and I had the cleaning, and I saw Dr. Malfarra, one of his partners, and Dr. Lou a couple of times. But I'm not that happy with the whole situation. And now I'm feeling, well, I am very uneasy about the dental work, or the lack of dental work, or lack of dentistry, rather, I maybe have had here.
I tell you how
in
I
the
look
last
at it for
15.
you. You're almost better off in the situation you're in. Because what if you came in and you just had spent
Oh,
a lot of money on
Yeah.
crowns,
Yeah.
and they all look like that one. And I have to tell you that.
yeah,
At least you didn't do that.
yeah.
I mean, you got them patched.
But they're telling me everything's, that's what I'm questioning with them, and I've told you it already, I think I'm going to this Dr. Rosner. I want another, not just opinion, I think he's gonna be the one, I have a feeling about it. Because I don't feel like, I don't feel right with these other dentists. I don't think I've been getting the right treatment. And, you know, because they told me a couple months ago, no cavities, everything looks great,
No, that's.
you know, and.
Listen, you have one cavity on the upper right, not even the one that we talked about
Yeah,
down here that we had a discussion
Yeah.
about. You got one on the upper right that very well could be a root canal. There's 100% probability. I mean, if I'm making that up, I should go to dental jail.
Yeah, right,
For-
right.
I mean,
Yeah.
I should. I mean,
Yeah.
if I'm that scrupulous that I need work, that I don't need any work.
Mm-hmm.
You know, I love new patients. I love what I do. I love meeting you and her.
Yeah.
But and
I
I'm
get it.
this is what it is. So here's what's going to happen. She's going to give without implants because I don't even know if she's a candidate.
Sure, we'll just do a CT read though.
We'll do a CT read, but I do need a scan on her just in
Got
case, so I don't have to wait. Scan is just an oral digital thing. It takes a minute.
Whatever.
It's a minute.
Whatever.
Remember the old impressions they used to take?
Yeah, yeah.
That's what it is.
Oh, I
Except it's not
see.
an impression.
But they did, yeah, Dr. Benzie's office did the
Yeah, did it,
impressions
sure. Right.
for the dentures, yeah. Yeah.
Okay, so
Yeah.
take that. Mike will come in here and will give you a quote on the things I know you have to have. And you don't have to do anything. You can take it home and think about it. You can. I would sedate, by the way, whenever we do.
Yeah.
I don't charge you for it. Yeah, I would.
So I
get her-
definitely need Janet with
Well,
me.
she just drops you off.
Oh, and then, but
She
that's.
can wait away. She can
and picks
stay.
me up.
It's
Gets-
better pick you up. All right, so
But I
he'll come
just-
in.
yeah.
If you have more questions, I'm down the hallway. He'll come get me.
Yeah,
But you understand my approach to you. I'm trying to be conservative. I mean it.
I do.
And I think you can tell by my candor that this is everything I've told you is authentic. I mean, I mean it. If it was you in the chair, I'd be the same way.
Like you.
I have a lot of work. I've been in the same spot for 45 years.
You don't have a boat and you don't golf. That was a biggie with me.
Right.
You know, they're all, you know, there's something, I mean, I can relate because of my music and my dedication
Yeah.
to not just music, but the horn and playing the horn and all my background and my history. It's music. It's
And
what's
you know how you
kept
get
me,
good at
it's
it?
what's kept me on, you know, on my feet. It's what's kept me going,
Sure, I get
and
it.
I get it, so.
You practice it. You learn how other people that play the
Yeah.
horn really well that you must know about that I don't know.
Yeah,
How they do it.
yeah,
I do the same thing except it's teeth stuff. I'll be back.
okay.
Okay. You guys want water or something?
No, thank you.
I got a lot of people and get it for you. Sure? I'll get it for you.
No.
Ready? One,